Hello, my name is Rizwan Ali. I am board certified psychiatric nurse practitioner, currently certified in the state of Texas and also the state of Arizona. So, today we will be talking about adjustment disorders. Adjustment disorder can present itself as anxiety symptoms, depression symptoms, uh, low mood, and irritability. So, adjustment disorder, the name itself says about everything about adjustment disorders. It's whenever someone is going through a stressful event in their life, such as maybe getting married, getting divorced, finding a new job, moving to a different house, moving to a different country, different city, um, also having lost a loved one, or having any kind of stressful event that triggers a significant response is when adjustment disorder happens in patients. So, for example, person will start to exhibit symptoms of extreme anxiety or extreme irritability. They may not start to do well at their job. They may not start to be very responsible in their relationships. Their mood can be down, sense of hopelessness, sense of worthlessness can start to take over, and overall depressed, and just anxiety, too much worrying, are some of the signs and symptoms of adjustment disorder. Um, People may not realize the reason for a change in their mood and the reason for them to feel the way they are feeling. Typically, adjustment disorder happens within 2 to 3 months of the stressor. So people may not realize immediately that they're experiencing these symptoms, but as the time progresses, they start to realize that these symptoms are becoming more and more prominent. So, what to do about adjustment disorder? So, the first thing is to obviously go to your primary care provider, primary care doctor, and get evaluated. And more than likely, they will refer the patient or the client to a psychiatrist or a psychiatric provider. From there, they will do different screenings. More than likely, they will start off with something called PHQ-9, which is a depression scale that checks for the rating of the depression, and also GAD-7, which is generalized anxiety scale, and they will also test for anxiety symptoms. Furthermore, they will do some mood testing as well, and upon further interview, um, a patient will be diagnosed with adjustment disorder. And what are the treatment options available for adjustment disorder? So, really, adjustment disorder kind of requires some time for a person to uh, kind of adjust to the new normal that they're in. Um, Mostly, therapy is the main treatment option for adjustment disorder for the long term. However, um, some medications, antidepressant medications, can come in handy in order to treat adjustment disorder symptoms such as the hopelessness, worthlessness, low mood, and those include SSRIs, serotonin specific reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitors, are some of the medications that come in handy. If the patient is really anxious, we can also utilize some anxiolytics such as Buspar or Buspirone. And if they are having acute anxiety or panic attacks, we can possibly use benzos. However, the use of benzos needs to stay minimal and not be as much. So these medications take about 2 weeks to start working, and after 2 weeks, the patient will come back and we will do a reevaluation. We'll do a follow up, and then after that, we'll do like monthly follow ups to keep up with the patient's progress. Again, therapy and medication are a combination of treatments for this particular disorder. Usually, after about 6 months or so, the patient will start to become like their normal self. and start to be more positive and start to become accepting of their current situation. Again, adjustment disorder can present itself as anxiety and depression. It happens after a stressful event in a patient's or a client's life, and some of the treatment options are mainly psychotherapy ongoing and also medications such as SSRIs and SNRIs. Thank you for listening.